Hello, welcome back to my channel. I wonder if anybody does that. They probably do. What if I do like this? That's pretty sick. Okay, I'll do that. Unless it becomes too cringy, then I won't do it. So, I need to stop the music because I lose focus quite quickly. Okay, Google, stop playing. Okay, so this is my first video, technically. And this is going to be what it's really like to be a nurse, at least in a SNF. So a little bit about me. I am a registered nurse. I graduated December 2018. I took my NCLEX March of 2019 and I passed it the first time, and then I started seeking jobs, and I accepted my second job offer, which was at a SNF, aka skilled nursing facility, and I've been working there since. This month it's going to be 9 months that I've been working there, and there's many things that I like, a couple of things that I don't. I've had many struggles, but I've learned so much from it. So this video is just kind of going to be a general video on what I think, or kind of like what have I experienced in this job. So first and foremost, let's see. This was my first job ever, kind of, as a registered nurse. Really, the first job I've ever had as a nurse. And I feel like it was a really good transition. So just a little background history on, I guess, who I am and how it was during nursing school. Let's just say I was never the fastest. I was never the fastest, actually. I was always the very last one to give my meds. I was the very last one to give report. But I love the program that I went to because for the most part, or at least I think one of my instructors in particular, she was so supportive, always encouraged me no matter how late I was. Well, I wasn't dramatically late, but she was literally an angel in my life, and I love her so much for the encouragement. There were so many times I felt like I couldn't do it, and she was just there pushing me on, and I love her so much for it, and I am so thankful, because if it weren't for her, I wouldn't believe in myself the way that I do now. So that being said, me being late in pretty much everything, being in a skilled nursing facility is so hard. I don't know what it's like being in a hospital, actually working there, because I haven't. I mean, only nursing school, doing clinicals, but it's so difficult because I usually get a patient to nurse ratio of 23-27 to one nurse, aka me. So we have 3 nurses on the floor at all times, or at least during AM and PM shifts. And then we have 3 stations. So those 3 nurses are the charge nurse for that station. So you're responsible of your entire station, and then you have CNAs that work alongside you. But pretty much, in a nutshell, what we do is in the morning, you get report. After that, I guess you can chart a little bit. And then from 8 to 10, ideally, you pass out your medications to all your residents, which gives you approximately 5 minutes per resident to just kind of say, hey, good morning, let me check your blood pressure, let me give you your meds, and then on to the next one. And then ideally, in a perfect world, from 10 to 11, you can start your treatments, which is any wounds, any bandages, pretty much anything, creams or stuff like that. And then from like 11 to 12, more like 11:30, you do your sugar checks. And then again, from 12 to like 1 or 2, you pass out medications again. And then after that, you chart again, and then you pass on a report, and then you're on your merry way home. The only thing is, for me, that's not my story. The reason being is because I feel, especially as a new nurse, you really focus on wanting to finish absolutely all of your tasks within your shift. There's so many things to do. And the way that I described it as getting a report, passing meds, treatments, and then more meds, and then charting and then passing a report and then you're done. It seems so simple, right? But it's not. The reason being is because sometimes you're passing out medications and you're on a time limit, and then someone's like, hey, so-and-so wants pain medication, or somebody falls, or somebody starts having chest pain, or someone has a serious like skin tear or something, and you have to stop what you're doing, or somebody gets like super aggressive, or you know, things like that pop up. So you have to drop what you're doing, and then you have to go attend that, and then by the time you come back, it's like 10-20 minutes later, and now your whole med pass is delayed, therefore your treatment is delayed, therefore everything is delayed. So it's just kind of been a struggle. I don't know what I really should be focusing on this video because I didn't really think about it. I was just gonna give a rant just because today was one of those days where I felt a little bit down because of what, so an incident happened in the morning that pretty much delayed my entire day, and I don't know, I mean, it's tough, that I will say. It is tough being a nurse because you're faced with so many things. You are caring for these residents. The doctors occasionally come in to see them. You know, you have family members that are questioning, you know, stuff that we're doing, and you're pretty much the person that takes care of them, in the sense that made no sense. Hold on. You are, well, you're their advocate. That's what nurses are, right? So, like, for example, you notice that something's wrong with the resident. You notice that a certain medication is not really helping. You're the one that communicates that to the doctor so that they can, based on your findings, can change their medication, start them on something new, or discontinue something. And doctors know what they're doing, but they don't know the residents to the point that you know your residents, because you see them every single day. You get to know any change of condition from them. You know, they start getting a little bit lethargic. They are like all of a sudden short of breath, wheezing. You know, where's that coming from? So you as a nurse get to see so many changes in residents. And the reason why I really, really love working at a SNF is for that same reason. You get to know your residents. I initially thought that I wanted to be a nurse at a hospital and care for residents, because the whole reason why I joined nursing was because I really liked helping people. I love that, like, people interaction. That made no sense. Just talking to people, and I love making people feel better, especially when they're down. So I thought, what better way than nursing, you know? And my idea of nursing, before me knowing what nursing was like, oh, you pass out meds, but you get to know people, you get to chat with them for like a couple minutes, 5, 10, 15, get to know them, and then just, you know, work on their care. Little did I know when I went into nursing school that it's, unfortunately, at least in my point of view, it's more charting based. So yes, you're caring for the resident, but you don't get to spend that much time with them because you have CNAs, you know, you have other things that you have to do. So unfortunately, it's not like that. And especially at a SNF, it's very hard because you have so many residents, so many things that you have to do, and you can't spend that much time with your residents because then you fall behind. So that's kind of difficult, but I really love it in the sense that I get to see these people every single day. I get to be funny with them, joke around, make them feel good, and just, you know, see that I'm actively, you know, working towards their recovery, especially if they're on the skilled side of our facility, because it's kind of divided into long-term, which is pretty much they might just stay there forever, or more the skilled Medicare side, where we get people post hip surgery, post knee, people that are septic, gastrointestinal problems, stroke patients, or let's see what else, amputational residents, or yeah, pretty much like uncontrolled diabetes. We get those kinds of residents, and we kind of, you know, kind of nurse them back to life, and then they get to roam free. So I mean, it's really nice, but it's really challenging as well. So I feel like this didn't really answer or explain what it's like. I guess in a few sentences, what is it like being a SNF nurse? It's hard, it's challenging, but you learn so much. You learn how to manage your time, because my time management has improved so much. It's still horrible, don't get me wrong, but it's gotten so much better. And I feel like I keep getting better every single day. And I hope I continue to do so, because I really want to be the nurse that in my mind I want to be. But I feel like because I'm still learning so much, and because I'm forgetful at times, I forget little things. And at the end of your shift, all those little things you start remembering. And then you're like, oh my gosh, I need to do this, I need to do that, blah, 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 blah. And the next thing you know, you're doing all these little tasks. And then it's 3, you need to give report. And you still have a few treatments that you have to do. You have to do all your charting, and then you're behind. So there's definitely so many things that I can improve on, which I'm striving to improve. But it's hard, it's challenging, which is kind of the same thing, but it's very rewarding in the sense that sometimes you're able to catch things that can be kind of life or death for a resident, really. And I feel like that's one of the biggest satisfactions that you can possibly have, is knowing that you did something for someone. Not just a treatment, but something that can be life-changing for them. And therefore, it kind of becomes life-changing for you, because it's an experience that you'll remember at least for a long time, or quite a while, you know? So, yeah. If anybody who's ever watching this has any questions about it, I guess you can write it down and maybe I'll look at it. Who knows? Maybe nobody looks at this video. That'd be funny. But yeah, and in the future, I guess I can make more videos of what it's like being in nursing school, different subjects in nursing school that we had, clinicals, NCLEX, applying for jobs while you're working, what it's really like, you know, submitting applications, especially if you don't really have experience. So if anybody has questions, let me know. All right, until then.